Hi, I'm Dr. Antimarino. I understand you want to talk about a possible tummy tuck.
Yes, I do. Can you give me a little bit more information on that?
An abdominoplasty, also known commonly as a tummy tuck, is consistently one of the most common aesthetic procedures performed every year. There's no better way for a woman to regain that pre-pregnancy body than with a tummy tuck. Most women, as you know, after pregnancy, especially when there's been multiple pregnancies, start to develop that excess skin, that pooch at the bottom, the laxity of the abdominal wall. So no matter how much you work out, how many sit-ups you do, how much you run, how clean you eat, you still have that excess skin. Also with the stretch marks that come with it. Those can also be dealt with in certain areas. There's no other way to get rid of them than with this tummy tuck. A tummy tuck is performed through a small incision on the lower part of the abdomen. It's really low enough so it's really at the end of the abdominal wall where it joins the upper part of the pubic area. So no matter what type of clothing you wear, bathing suit, bikini, all of that is hidden by the clothing. The nice thing about the tummy tuck is it's really two corrective procedures in one. So through that small incision at the bottom, you can take away all that skin that you don't like between the belly button and the pubic area. So if you have stretch marks in that area, they're taken away. The little bit of excess fat is taken away. The excess skin, taken away. Now the surgeon has access also to the abdominal wall, right where the muscles are that need to be tightened up from the babies pushing out on it. We can actually tighten up those muscles, give you an internal corset, and that's what really slims you down and really makes that belly nice and tight and restores that, kind of almost like a washboard stomach. And then you pull the skin over the top of that. So it really restores that hourglass figure. With that corset effect, we can really pull in your waistline and accentuate the hourglass and around the hips. Post-operatively, most women can say that the pain is mild. They mostly say that there's some tightness, but they're not really having any pain. It's more discomfort. I usually recommend at least 2 weeks off of work for most jobs. I don't let anybody exercise for 3 weeks. There are drains involved, and they're usually removed between the first and second week. For the first couple of weeks, you're usually in an abdominal binder, and that helps really kind of cinch everything in, keep the swelling to a minimum, and give you that support. After that, I have you wear compression garments for about the first 3 to 4 weeks, and then after that, only when you're exercising. So by the third week, you're really back to almost everything you want to do. You're back to your lifestyle. I don't let anybody start running, jumping, or jogging for about 6 weeks, and you certainly don't need any core exercises. For at least 2 months, everything's nice and tight, and then after about 2 months, most people can go back to that. The downtime for a tummy tuck is slightly longer than most procedures because it involves your core muscles, and you start to really realize how much you use them. Going from a sitting to a standing position, getting out of bed, you're going to feel those muscles tighten up. So I want you to take it easy for a little bit longer. Overall, it's well tolerated. Women love it. It really gives you back that body and gives you that confidence so that you can go back to wearing all of the clothes you wanted to wear since you've been pregnant. It allows you to be a mom, but really look like that lady that she was before she had children. Have I answered all of your questions?
Yes, you have. Thank you very much.
Bellissimo Plastic Surgery, your partner in defining you.